A month into the coronavirus pandemic response, and many Kansans are frustrated by a lack of information coming from the government. Plus, the good, the bad, and the ugly coming from the Department of Labor about unemployment insurance, who's getting their money, and who will have to keep waiting. All as the governor announces her plan for a slow reopening of Kansas' economy. What does it all mean for you? That's what we're talking about right now on Kansas Week.
Southwest National Bank has proudly served Wichita and its surrounding communities for over 100 years. We are happy to support KPTS, Public Television for Kansas.
Continuing coverage of the COVID-19 pandemic in Kansas is funded in part by a grant from the Facebook Journalism Project Community Network Grant Program, run in partnership with the Linfest Institute for Journalism and the Local Media Association.
Welcome to Kansas Week. I'm your host, Pilar Pedraza. We continue to bring you all the latest you need to know about the pandemic by diving beyond the headlines. This week's biggest headline, the governor's plan to reopen the state, announced in a live address Thursday night.
The decisions we make in the coming weeks and months, including the order in which we make them and the pace at which we implement them, will determine what Kansas looks like after this pandemic has run its course.
Still urging caution, Governor Laura Kelly described her three-phase plan for the public. Unless the medical situation changes, Phase 1 will begin on Monday, May 4th. During Phase 1, businesses can reopen as long as they can maintain social distancing and proper hygiene. This means close contact businesses like hair salons and gyms, as well as many entertainment venues, from bars and nightclubs to movie theaters, will remain closed. A 10-person limit on gatherings will also remain in place. If the medical situation doesn't get any worse, Phase 2 will then come 2 weeks later, starting May 18th at the earliest. Some of those close contact businesses, like beauty salons and bars, will then be able to reopen, but large entertainment venues and summer camps still won't. The group gathering limit will jump to 30 people. Again, if conditions allow, Phase 3 will come 2 weeks after that, no earlier than June 1st. At this point, on-site staffing will become unrestricted. Non-essential travel will resume, and mass gathering limits will increase to 90 people. Some Kansas Republicans who have been pushing to reopen the state were not happy with the slow pace of this plan.
There's a lot of restrictions in this order, and instead of helping us out, she put her foot on the gas and she implemented restrictions that no one expected.
While some business owners who'd been hoping to hear they could open up on Monday only to learn they're on the no list were also disappointed.
I felt over-prepared almost for this. So the fact that now I was over-prepared and now I just have to wait 2 more weeks. So I guess I'll look for my next, what else can I do to improve the business?
Now, this is just the bare bones of the governor's reopening plan. Here to help me dive into the rest of it and what it means for you, I'm joined here on the desk by Suzanne Tobias, the opinion editor of the Wichita Eagle, and Travis Mounts, managing editor of the Times-Sentinel News. And joining us by Skype, we have Nick Haynes, the host of the Kansas City version of this show, Week in Review, on our affiliate KCPT. Welcome, everyone.
Thank you. Thanks.
All right, so I'm going to start off with one of the big questions that a lot of people have had is, how does this all work? Restaurants, very confused. I've had 3 or 4 people call me, as a restaurant, what is it that I have to do? Can I even open in phase 1 or not? This is a very complex plan. What are you guys hearing as far as the confusions with this?
A lot of the same. I'm hearing lots of confusion, lots of unanswered questions, and even today the Sedgwick County Commission met today to try and figure this all out, and they had questions that won't be answered by their own staff until next week. It's just the deliberate, rollout of this plan, on one hand is she's very specific about certain things, but it just raises all kinds of other questions, I think.
Well, certainly uncharted territory all the way around.
Yeah, but that describes this entire situation. This is new for everybody at all levels. The fact that people are upset that it's too much too soon and not enough right now makes me feel like we'll probably have found some kind of a middle road that's going to work. I mean, the underlying fear here that I think is driving everything is what happens if we get another spike? What happens with a second wave, especially if it happens immediately? Because nobody wants to lock the economy back down again. That's, I think, is our worst case scenario, is to go back to where we were at the end of March and beginning of April. And so this is kind of trying to ease our way in without going,
And I think that fear is part of why we see something different happening out in Johnson County. Nick, they made a decision, several of the counties in that area in eastern Kansas, to continue with the lockdown for a little bit longer.
Yeah, in Wyandotte County and in Johnson County, where we have some of the heaviest concentration of Kansans, they've decided to delay a week. And just before we started this program, I just learned that Douglas County, where we see the home of Lawrence and the University of Kansas, they're now stopping restaurants from coming and opening for another 2 weeks. So there is a lot of confusion. It is a puzzling tapestry, a patchwork of different rules and regulations. When you're in a city like Kansas City, where you have a bi-state road that dissects the community, on the Missouri side, for instance, they say you can only have 10% of your tables in use at any one time. And you also have to take down the names and numbers of every single customer who sits down. So they're asking these restaurant owners, in addition to everything else, to now play the role of doorman and police officer at the same time.
Some interesting requirements there in Kansas City. What's the reasoning behind some of that?
They want to be able to do the contact tracing. So if there's any problems, they can go after those people and then contact those people. Now, it's very difficult to enforce these things. And this also sets up the problem that many business owners have already, which is, why is it that you're picking winners and losers and putting different regulations on different type of businesses? For instance, nobody has asked anyone who is going to a grocery store anywhere in Kansas or in Kansas City, or going to your local Target or Walmart, you have to take down those telephone numbers and phone numbers. Why is it that we're expecting restaurant owners to do that?
Yeah, I know as the governor was making her announcement about this, she talked a lot about how she talked to the different industries and the various needs of the various industries, but there are also differing needs from county to county. And she did say that this is a basic framework, and that if counties feel they need to go further, they should, which obviously some of our eastern Kansas counties have done. If you need more details on the reopening phases and what will be changing on Monday, the full plan is online at covid.ks.gov. Now, even before the governor announced her plan, some city and county leaders were already looking ahead to potential problems. Some of the things we've been talking about here with the confusion. Cake News' Bree Smith shows us what they were thinking about it.
I think we're ready to go to start putting our toe in the water.
For more than a month now, we've been urged to stay home so we can stay safe. Soon that might change, but not without challenges.
Moving forward, one of the biggest obstacles is going to be good information, getting good information out.
Kansas Governor Laura Kelly is expected to reopen businesses across the state as early as next week. Mayor Brandon Whipple told us this is prime time for our screens to be flooded with fake and misleading stories. He's worried this might cause some confusion.
At the same time, we saw people pushing out toxic information about get out there, defy the order, go do this or that. The very next week, we saw a bump in numbers. We saw a bump in deaths.
County Commissioner Pete Meitzner addresses another possible concern.
Sedgwick did this, but Butler did not do anything. Does everybody go Sedgwick to Butler?
But he's confident the governor has considered this.
I believe that the governor's order is going to be statewide just because of that concern. And that adds stability to.
Whipple says the best thing we can do to keep each other safe is to hold each other accountable.
We are learning much more now than we did 6 weeks ago, and we have to trust people to take that into account.
And certainly the fear of a new spike is what's holding a lot of people.
One of the unanswered questions is, what is that threshold going to be? I mean, yes, we talk about if it spikes again, we're going to have to go back or reinstate some restrictions, but at what point? You know, what rate, what number? Is there some threshold? And who's going to and who's going to decide that? And this idea that it's a statewide order, well, yes, it is a statewide order, but as we see, there's different restrictions everywhere. Just this morning in Sedgwick County, their health officer wanted to further the restrictions here and include things like buffets and fountain drinks and things like that. And Sedgwick County said, no way, we're not going to be more restrictive than the state. So it is a real patchwork and real confusing to a lot of people.
And certainly I know that's been the case both here in the Sedgwick County area and also in eastern Kansas. Nick, you were talking just a few minutes ago about how different there is. I know that there were some complaints from eastern Kansas businesses early on saying that folks were coming from Johnson County out to, Chase County to go to restaurants or do whatever. And they're like, you've got the virus there, leave us alone. Are there any issues, any regulations in place to kind of prevent that happening this time around as the stay-at-home order extends for another week out there?
I think, and by the way, your example there would also include people just south of you in Kansas going to Oklahoma. And I notice Oklahoma this very day has now opened up all the restaurants. You can go to a movie theater just over the border in Kansas. You can go to the gym in Oklahoma, just a hop, skip, and a jump from the Kansas border. So there's nothing stopping people doing that. What I thought was missing from the governor's order, and I actually think she did that most remarkable speech I've ever heard her give this week. She's not the most charismatic governor. She's not the best speaker as a governor, but I thought she did an incredibly solid job on that speech. But one thing missing from the whole thing is enforcement. All the way through this has been really about, rather than government forcing on police getting involved, it's really been about volunteer compliance. Oftentimes, it's about community pressure and, dare I say, public shaming. The police they don't even want to be part of the picture. In fact, we have police departments now in Johnson County that say we are fed up of all these people calling in and saying they have a neighbor across the street and there's too many people in the backyard. They're getting frustrated by that. And their view is we have to police this situation after the pandemic is over. If we start being very heavy-handed now, no one is going to trust us after this, and the public is going to remember.
Now, Travis, you're in more rural areas. What are you seeing when it comes to all of this, folks moving around, trying to find where they can have the most freedom?
I think a lot of people have been trying to stay at home and on their own volition, doing the things that they need to do to try to keep themselves safe and keep others safe. I think part of that is because in our little footprint in Southwest Sedgwick County and Sumner County, we have seen 8 of the deaths in our region are in my coverage area, 6 of them being at the nursing home in Clearwater. That was the most recent number that was updated last night or this morning. And so it's very easy for us to know somebody who has been impacted, whether it's the loss of a loved one or somebody who just got sick and was dealing with that. And so, and again, I think there's still the broad range of opinions, people who think that this is overblown and that we ought to throw everything open, but I see lots of businesses who have been following all the recommendations, putting lines on the floor, employees wearing masks, and so everybody wants to get past this, but at the same time I think lots of people want to make sure we don't go through this a second time. One long time is better than a second and a third time.
Nick, you had a comment?
Yeah, I just want to make a couple of points when it comes to businesses. Number one, I've been amazed actually at how proactive they have been, regardless of government regulation, to prepare for that. Now, we know big box stores like Costco in Kansas have decided starting on Monday, no government edict involved, that every single customer has to wear a face mask. And we've been talking to restaurant owners on the Kansas side that say they've already been putting up plexiglass screens. They've removed all of the condiments from the tables. You will not be able to get a printed menu. You're going to have to look that up on the phone. They've been incredibly proactive. So this is one of the things I'm concerned about at this point, or what we may see, is we have certain businesses who are being deprived the opportunity to open whatsoever. For instance, on the gym front, gyms are not allowed to open, but there's a whole range of gyms, and there are small boutique gyms where you have to make an appointment to go and speak to a personal trainer. So there's very few people in there. And there's already now threats of lawsuits that we're seeing from some Johnson County businesses to the governor's new order. So just like we saw with churches where they were unhappy with what the governor's restrictions were, I think we're going to start to see some new lawsuits being filed by those businesses who feel they're being mistreated and treated unfairly.
Well, and certainly playing into that unhappiness is the hundreds of thousands of Kansans who are currently unemployed. The governor's slow ramping up of the economy means economy means a lot of them are going to continue collecting unemployment for at least the next few weeks. In the last month, Kansans have collected $108.5 million in aid, with more than 27,000 new claims in just the last week alone. More unemployment payment problems in Kansas. Some say they still have not gotten the extra $600 in federal unemployment money. It's been a week since the state said it found a solution to the problem. The Kansas Department of Labor says to hold on, the money is coming.
You should receive that additional $600 on your debit card no later than tomorrow. And if you receive your benefits by direct deposit, no later than Friday.
The Department of Labor expects back payments for missed weeks to start going out next week. The governor herself and the Secretary Garcia and the Department of Labor all admit there is a problem. The computer system is outdated. We were overwhelmed. But the question becomes, they've had a month. Whose fault is it that we're still having these issues?
You know, to some degree, I think it's nobody's fault because the sheer volume just overwhelmed everybody. I don't think we were really prepared for the kind of situation that we are seeing just in terms of the sheer numbers of unemployed. And I think that because I look at other states and so many other states are in the same boat. If everybody was unprepared, then I think it was just a problem that was really hard to envision to begin with. And so much planning that was done around a viral outbreak like this was from the health side. You know, the secondary and tertiary impacts, I don't think we're getting the same level of attention as just trying to keep people healthy and alive.
It certainly doesn't help matters that the state does have a 40-plus year mainframe computer handling this call and all this volume of calls, and so yeah, we've had commentators in the Eagle write and say, you know, IT is not a sexy issue in the legislature, you know, like upgrading the infrastructure of our technology in places like the Department of Labor is not something that ever gets attention. Maybe it will now, too late, but that's certainly
Hopefully
one of the factors. Yeah.
Some very good questions. Now, Nick, I know that the last time I spoke with Secretary Garcia and the Director of Unemployment, Laurel Klein-Searles, she said that they covet the upgraded system Missouri has. So I'm wondering, with your perspective there right on the state line, what's the difference been like?
We certainly heard complaints. As Travis mentioned, it's been happening everywhere. This is an unusual situation. And I think what's happening when the governor says, yes, you know, we have an antiquated system, it hasn't been invested in, that might be true. But if you're one of those individuals who is heartbroken, has spent 6-7 hours a day early on in this, trying to call or go to the website and have it crash on you or being hung up on, you are going to remember that, and that's not going to be good for the governor. People are going to remember when they didn't feel they were being fully served, regardless of what the reason was. And yes, this has been an amazing situation. But in the beginning, probably I was hearing 2 or 3 calls a day to our station here from people on the Kansas side, absolutely despairing over the situation. I'm not getting those calls right now, and I did look at the latest figures. I think they're down now 8% of the unemployment claims being made this week. So it is going down. And so I think I haven't heard any people call me recently saying that they have those issues. The biggest issue now, of course, is the rent issue. On this very day, May 1st, we have the moratorium on evictions and foreclosures ended in the state of Kansas, and people have to pay rent and mortgages, and they will be evicted. And at this point in time, they've sort of pushed the can down the road and said you can't be evicted and foreclosed upon. Now the rent is due. Now the mortgage is due. What is that going to do for people in Kansas? I do know that starting on Monday, there's going to be a lot of rent protests around our area.
I would not be surprised to see those happening here as well. I know I've gotten quite a few calls as well about rent and mortgages and evictions. Another issue that's really coming up now as the original trying to get through to the unemployment system has fallen back because they've kind of gotten some of those issues fixed is the self-employed in unemployment insurance that the federal government had promised, but it doesn't usually cover. They're having to figure out how to get it into that 40-year-old mainframe, and it's still going to be weeks. And these are people who need the money now.
Right, and then with all the things happening with the PPP loans and all of those. I mean, we have small business and self-employed people trying to get through on, you know, some of those loans and get some of that help, and that's not coming either. And it's distressing, and yeah, it's one of those situations where who is to blame, and even if you find out who's to blame, you know, how do you fix it?
All right, well, certainly one thing that everybody wants right now is information. But there is increasing frustration across the state with a lack of some information about the virus, with only some counties reporting how many have recovered or where clusters are located. The Wichita Eagle and Casey Star are both calling for that to change. In two very similar editorials, the Wichita Eagle and Casey Star called the lack of information about pandemic developments a danger to the public trust at a time when it's needed most. The Casey Star pointed to Johnson County's lack of openness about clusters of cases and deaths at local nursing homes, reportedly not even communicating with relatives of those directly affected. The Eagle pointed out Sedgwick County leadership's refusal to name the locations of 2 new clusters identified just this last week, or even the church clusters at the center of the debate about restricting religious gatherings. And it's not just about identifying clusters. Reporting on other information varies from county to county, some providing recovery numbers, some laying out the racial and ethnic breakdown of who's getting sick. Others not. Officials repeatedly have cited privacy concerns as the reason for keeping these sorts of details secret, but the Eagle concluded during this public health crisis, Kansans have been asked to sacrifice some individual liberties for the greater good, and that requires trust. To maintain that trust, our leaders, whether elected or appointed, must be open and honest about any threat to our health and our lives. And Kansas has a history of being one of the worst in the country for transparency. We've talked about that on this show many times before, our frustrations trying to get information from the state, from county leaders. How much of what we're seeing right now is that history of not wanting to share information? And how much of it is the unparalleled nature and the emergency nature of the crisis that we're in right now?
I like to think it's the latter. I don't think, you know, we will argue sunshine laws, you know, every day of the week on this show if we want to, and I will gladly do that. But right now, obviously, it's an unparalleled time. However, there are clear matters of equity here. You have, you know, if you have 7 clusters and you identify 2 of them because those businesses happen to agree to put out a joint press release, then where does that leave, you know, what's to say? It raises suspicions about who they're protecting, why. Maybe they are under control, but I just think there should be some across the board guidelines on that. Either identify them all or don't identify them. But it just seems to be, for public safety, the safest way to go would be to identify them all, so that if you happen to have any business with that particular entity, you could know.
Well, and having that information gives us a better idea of the types of situations where this disease is getting spread the most. And that then lets the general public kind of alter their behavior to keep themselves safe, to not endanger somebody else. And I think that is a huge piece of information that needs to be out there and isn't.
And Nick, I know that Wyandotte County has been one of the leaders of getting information out there, while Johnson County has been called to account for lack of information. How is that working out? Is Johnson County starting to catch up now?
Well, I wouldn't say they were a leader. That information was disclosed, and this was a facility, a nursing facility in Wyandotte County that is now clocked, at the time of this program, 32 deaths in just one facility. That they weren't happy that all of that information got out. So it wasn't that they wanted to say all these things. In Johnson County, again, the state's highest population county, 70% of all of the deaths have been in nursing homes. And yet up until last week, no one had any clue whatsoever that was the case. There were loved ones who had, they had relatives in these facilities, had absolutely no clue whatsoever, were flabbergasted, very upset about it. And I think when we look later into the lessons we learn from all of this and what changes after this, what a chilling effect this is going to have on, first of all, any elderly person wanting ever to be in a facility, or a child or a grandchild responsible for that elder person's care to ever want to put them in a facility ever again.
Yeah, even if it's necessary, it's something you're going to think 2 or 3 times about after this.
Right. I mean, obviously that's a population that's, immune, deficient anyway, and there's lots of, health problems that they might have. But yeah, it does not help matters for them not to just be clear about what's happening in there too. It just raises suspicions, from the public.
Yeah, and it shows how quickly this specific virus can spread around. Because in most of these cases, it was probably one person coming in, but in those tight quarters, it gets around very quickly. And I think it really reflects the meatpacking plants out in western Kansas as well. Close quarters, lots of people, and a disease that can just spread, like wildfire.
And we just trust that the contact tracing is working, but I mean,
Well, it sounds like the contact tracing is just now starting to get underway, really. From what Dr. Norman was saying, they're still in the process of hiring and training contact tracers. And Nikki, I hear you have a comment.
Yeah, I just wanted to know, is the contact tracing working, or is this a cosmetic thing to make people feel better? Even in that Wyandotte County nursing facility where more than 30 people have died, there are still loved ones who said they had no idea whatsoever. People were released from the facility, and they were contaminating people in their family, and they were never told anything.
Wow. Well, and I have to ask just very quickly, one last question, short answers, please. Is releasing more information, letting people know where these clusters happening, a way to help people, the general public, really take this more seriously? Because right now all we're hearing is numbers, and numbers are kind of a cold, unfeeling thing.
Yes, it would help, because when you can match a face to information, it becomes personalized, and that's when people start caring.
Just like the masks. We're told, that masks are a visual reminder of what we're fighting here, and that information is too. It just helps.
All right. Nick, do you have a comment?
Sorry. I think it lets people off the hook, though, because if you think that most of the deaths are occurring in nursing homes, I have nothing to fear. And it may give people a false sense of security to think that all of those, if I'm not in a nursing facility or not around somebody like that, I have less chance of ever getting this.
All right. Well, thank you again, Nick, Suzanne, Travis, for joining me. I've enjoyed our conversation. I hope that you, our viewers, have found it useful. We'd love to continue the discussion with you. Seek us out on Facebook, Instagram, and Twitter. Just look for Pilar Pedraza TV and KPTS Channel 8. For now, stay safe and have a great week.
Southwest National Bank has proudly served Wichita and its surrounding communities for over 100 years. We are happy to support KPTS, Public Television for Kansas.
Continuing coverage of the COVID-19 pandemic in Kansas is funded in part by a grant from the Facebook Journalism Project Community Network Grant Program, run in partnership with the Linfest Institute for Journalism and the Local Media Association.